Okay, welcome to our last day before the quiz. Remember, we have a quiz on Friday. Today we are going to talk about pandemics. So pandemic is, as we discussed at the end of class last time, an epidemic that has spread to be global in nature. So it is on every continent. And also recall that it has to be contagious. So we talked about cancer or heart disease or things of that nature. Those are not pandemics because you can't catch them. So I'm going to show you some rather graphic photos. The ones that are pretty graphic, I have a stop sign before the next slide so you can avert your eyes. But it's interesting because you hear about these diseases. You hear about typhus, you hear about Ebola and HIV and all of these diseases, but you don't maybe know what they look like, how they impact you, and the scale of deaths that have gone on back through time with these pandemics. So I hope to give you a taste of, again, what they look like, what they would feel like, how you would recognize them, and also a little bit of a feel for vaccinations. You hear a lot in the news about vaccinations and whether they cause autism or they're linked to other sort of illnesses, or whether they are, great things that save millions of people. So I hope to tell you about the efficacy of some of the vaccinations that occur for these viruses. So currently, our world has one pandemic, and that is HIV/AIDS. And this is something that has been, it's terrible, but it's a good news story in that we have developed the drugs with which to not cure the disease, but to fight the secondary infections, which is actually what people will die from. And people are now, as long as you have access to a very expensive cocktail of medications, able to live out a normal life expectancy. Problem is, most of the people that have it are not in places where they can afford or have access to these drugs. It's a question of getting them there. So these are a couple of pictures of people suffering from AIDS, which is caused by the HIV virus, and I'll show you the virus in the next page. This is something that was traced back to Kinshasa as the genetic history. It almost certainly originated in Kinshasa, which is the capital city of the Democratic Republic of Congo, around 1920. But it wasn't recognized until 1981, and by 2009 it had caused 30 million deaths. So a lot of people died from this. Right now there are 35.5 million people that have HIV. 10% of them are children. And we will see how that is impacting the continent of Africa when we talk about population in a couple weeks. There are about 2.1 newly infected people per year. The place where the largest number of infected people is on the continent of Africa. There are 5.9 million people that have this HIV. Southeast Asia, there are about 4 million people. We have 1.5 million people in the United States that are afflicted with HIV virus, and the little bit of scary thing is that 20% of the population that has it don't even know they have it. So they're spreading it around. So this is what it causes. You can see it causes these flu-like symptoms, coughing, tuberculosis-like symptoms. We'll talk about tuberculosis later and the symptoms of that. You have different types of cancers, lymphomas. You get it by sex, and it's actually most frequently contracted by heterosexual sex, despite these myths that it is a homosexual disease. And it is also spread by pregnancy. Not always the case that a baby will have it from the mother, but it sometimes happens, and you can get it actually by breastfeeding as well. So an HIV positive mother could have a non-HIV positive baby, but who then can get it from drinking breast milk. So that is the current pandemic. In terms of what it looks like, it is a retrovirus. And so what retro means is that it infects immune system cells. So it itself is not the thing that kills you. What kills you and what makes you sick is the fact that you have no immune system. And so you are then exposed to illnesses that you'll contract, and you don't have the ability to fight them off. So that's what a retrovirus is. It impacts the immune system. It's also called a lentivirus, and we'll look at leprosy and a couple of other diseases that are lentiviruses. What that means is that it takes a long time to manifest symptoms. You could be HIV positive for 5 years, for 8 years, and show absolutely no symptoms. And that's tough because in that time, regardless of which lentivirus we're talking about, you are potentially infecting other people because you don't know you have it, you're not seeking treatment for it, et cetera. and it is a long duration. Essentially, it's there forever. Although it takes a long time to manifest symptoms, it has a very rapid, as you can see, replication rate. So it gets in, the way that a virus works is to attach to your cells and duplicate its DNA, and then your cells will rupture and send a whole host of new virus cells, essentially, out to attack other cells. So it replicates very fast, and the vaccine that we are sort of in the process of trying to perfect right now has only a 30% efficiency rate. So the way that you treat this, the way that you prevent death, again, the death would come from a secondary infection. You would become sick with something else because you have no immune system, would be by having antiretroviral therapy and by doing things to stimulate your immune system. So what that does is to lower the transmission risk, you giving it to other people, and it also lowers the risk of having these pulmonary issues. But the disease medication all have side effects. There's a huge number. I think you have to take 18 different pills every day in order to fight off everything. And each one of those has a side effect. So not a pleasant thing, but this is what an HIV, the HIV is the green dots, and they are coming off of a lymphocyte, which is your white blood cells, which cause an immune collapse. So that's HIV. Again, that's the only of the diseases that we'll talk about today that is a current pandemic. And I told you some of the numbers. Again, in terms of what you have to know for the quiz, certainly you don't need to know the numbers, but have a feel for the scale, have a feel for the fact that this is a pandemic, this is the current pandemic, and I told you up in this slide that there are about 35.5 million people that are affected, and we have an infection rate of about 2.1 million people per year. So now we will look at, you don't have to write anything down about this because I have a slide on each one. We're going to look at the pandemics of the past. And you're going to read in your book about a couple of different pandemics of the past and how things played out, how they buried the bodies, how they tried to prevent the spread of things. We have some very good news stories with regard to preventing the spread of diseases that could be future ones. We'll talk about future ones. Things like the Ebola virus, which was ravaging Liberia last year, and then also avian flu. It's always sort of in the background. But these are the things we're going to talk about. And again, I think you probably all have heard about them. You've probably been immunized against some of them. And the benefits of immunization, I'm not here to proselytize and tell you that it's great to get these immunizations, but they have eradicated many of these horrible, horrible diseases within a very short period of time. I do a lab sometimes in this class. We may try it if we have enough time. A lab where I give someone a whole bunch of Post-it notes and we walk randomly around the room and you see the rate of infection. The person gives you a Post-it note, you're infected, without any of the population being vaccinated. And then we vaccinate half of the population. So when the Post-it note person comes around, you say no if you are vaccinated. And then we vaccinate 3/4 of the population. You get to see this. And vaccinations, the neat thing about this exercise is you get to see firsthand how you really can kill off a pandemic by protecting part of the population. So let's look at these. Cholera. It became widespread in the 19th century, and since then it's killed tens of millions of people. You can read about, and I won't talk about the details, but there have been 7 pandemics, and it's hit every country in sort of localized regions very hard, but then it spreads globally. So India, Russia, Spain, Mexico, Europe, China, all of these continents and countries, it's all over Africa, Indonesia, the Philippines, North and South America. There have been a large number of people who have suffered since the 19th century from this disease. There have been 7 pandemics since the early 19th century that have, again, spread all around the world, and then it gets wiped out. We don't have cholera here. We have clean water. We'll look at what happens. But and where there's dirty water, where there's unhealthy drinking water, that's where it tends to spread. So right now, there are 5 million people who have it globally, and of that, 130,000 people will die. So it's not always fatal, but it's very, very unpleasant. So if you're squeamish, maybe turn your eyes. The primary symptom of cholera is profuse diarrhea, profuse vomiting of clear fluid. This is a picture of the diarrhea. Gross, right? The symptoms usually start suddenly. You're sitting there, you're fine, and then suddenly you have, about 5 days after you've been infected, you have severe diarrhea that looks like, it's called rice water because it looks like what you pour off of rice if there's too much water, and it has a fishy odor, and an untreated person can produce 5 gallons of diarrhea per day. So you can imagine, I know it's awful, right? Awful. So you can imagine, and vomiting as well. So you can imagine this is not a pleasant thing to have. Severe cholera, if it's not treated, it can kill about half of the infected individuals. So, and if the diarrhea is not treated by antidiarrheals, you can develop, obviously, dehydration, electrolyte imbalance, you go into shock, and you die. It's been nicknamed the Blue Death because a person's skin may turn bluish gray from the extreme loss of fluid. So that's what happens, this huge loss of fluid. You can see here some of the other symptoms: sunken eyes, cold blue skin. This is a man who has cholera. You get wrinkles as if you've been in the bathtub too long, but it's because you just have no water in your body. This is a bacterial infection, and so it's easily treated with antibiotics. And just to be clear, probably you're all clear these days, but there is the situation that we have many diseases in this country that are antibiotic resistant, bacterial infections that are antibiotic resistant. The reason for this is because, well, it's twofold. One, the overprescription of antibiotics, especially for the wrong thing. I've seen a lot of people with a virus trying to take antibiotics to cure the virus. Doesn't work. So it has to be a bacterial illness, and we'll talk about which ones are bacterial, which ones are viral, and then there's one that's actually a parasitic disease, in order for it to be cured by antibiotics. Other things, sort of side note, up to 88% of antibiotics in this country are fed prophylactically to dairy cows and to beef cows to prevent illness because they're in such cramped quarters. So if you eat a typical American diet, you're exposed to a large amount of antibiotics every day in the milk you drink and the meat you eat. So that is leading to antibiotic-resistant bacterial illnesses. So kind of a tough thing. And some countries have banned prophylactic antibiotic use in animals for this reason. We all have this constant rain of antibiotics into our system, so then when we actually need them, the bacteria that we got are used to antibiotics, and so it doesn't work. If you've ever had strep throat, you take that antibiotic and it doesn't cure it. You have to go to harsher ones that are kind of bad for your system. But anyway, bacterial illness, and so it's treated with antibiotics. And also, in order to prevent this copious diarrhea, you would take an antidiarrheal, and you would take also some oral rehydration, Gatorade kind of stuff, and salt electrolyte stuff, zinc. So that's one bad disease. Influenza. There are lots of different strains of influenza. This is called the flu, right? And it was first reported in Russia in 1889. It rapidly spread. It spread west, and then it hit North America, and then South America in 1890 or so. So it took a year to get over to here. But there are subtypes, and again, not something you need to know, but there's H3N8, H2N2 are the ones that we're talking about in the book when we talk about influenza. It is a very high attack rate, a very high mortality rate. So in that time, it caused about 1 million fatalities to have influenza. A variant of that called the Spanish flu was hit in 1918, and it was U.S. troops that were training in Kansas first experienced this flu. And it spread from the troops in Kansas and became a worldwide pandemic, and it was huge. It was probably the biggest pandemic ever. It infected about 1/3 of the world's population. So at the time, that was over 500 million people had this flu at the same time. Problem is, this was an unusually deadly and virulent strain of the flu, and it's weird because it just ended. It started quickly, everyone had it, and then it vanished completely within 18 months. And we didn't have flu, we didn't have vaccinations or anything, it just stopped. So in 6 months, estimates were between 50 million and almost 1 billion people died in this pandemic. India, about 17 million people died. United States are about 750,000 people that died. So it was interesting thing about this is that it was thought to be extinguished, it's not here anymore, but it was recently reconstructed by scientists at the CDC. They found a human remains preserved in Alaskan permafrost. So they took this, they extracted this virus, and they're now studying it in a controlled sense at the Center for Disease Control. So this is, according to the World Health Organization, just, again, kind of for your interest. It's not something that you'll be tested on in terms of what the levels are, but these are the numbers that the World Health Organization will assign to different influenza strains to see how worried we should be. So there are all these subtypes, right? So you may have heard, oh, I got the flu virus, what do you call it? Flu shot, right? Got the flu shot and I still got the flu. We'll talk about future cases of flu. We're talking about a past one here in 1580. This is a virus that mutates rapidly, and there are these subtypes. And so when scientists try to develop an antibody for it, the reason that you sometimes don't have protection is because scientists take the top 2 or 3 subtypes or 4 subtypes that are going around right now, and they make an antivirus for it and then give you the flu shot. You may get some other subtypes. I think 2 years ago, it didn't match up well at all. And then last year, it matched up pretty well. So we had low numbers. So on the scale, we would have things like, about 2 or 3, and then going up to 4 or 5. We haven't had a 5 or 6 in your lifetime. But that's influenza. And you can see the things that happen when you have influenza on the next slide. Oftentimes when you hear the flu, I have the flu, people talk about stomach virus. This is not a stomach virus. This is that cold, fever, achy, chills, all the things that happen here. Young children can vomit as a result of having influenza, but this is not the stomach virus that you think of that also goes around. The stomach virus, we don't even try to make a vaccine for. And the reason for that is because it's like shooting a moving target. The stomach virus will mutate so rapidly, you just can't get a matchup, so we just kind of don't even try. So with this one, we have fever, runny nose, sore throat, muscle pain, headache, coughing. So you have, sorry, that should say TWO. Begins about 2 days after exposure. Someone sneezes or coughs on you, and then you have this flu. The one that was coming around this winter was very, very virulent. We had people out for a week or 2 weeks, just not ending. So not the stomach flu. And then you can get, because your immune system is suppressed, you can get these secondary complications. So you can get pneumonia because you're not as able to fight these things off, whether it's viral or bacterial. Can get sinus infections. And then those who already have compromised respiratory or immune systems can also get secondary infections that could get quite scary. Asthma, heart failure. These are the things that will kill someone if you have the flu. When you have heart failure, you already have a compromised circulatory system, and then you get this, and it just goes to nothing. So vaccine, again, I was talking about the vaccine. We sometimes hit, sometimes don't. So your decision to get the flu vaccine is really kind of an optional one, unless you are having some of these compromised immune system, respiratory system illnesses, asthma, things of that nature. It's a good idea to get this. The Greek physician, Hippocrates, he was called the father of medicine. He first described the flu, influenza, in 412 BC. So this is a really, really old, the oldest one of the diseases that we'll look at. First one was recorded in 1580. And we have these massive outbreaks every 10 to 30 years. So you have this cyclical situation where it kind of goes away, and then lots of people get it, goes away, lots of people get it. So that's influenza. We'll revisit influenza when we talk about avian flu or bird flu, which is a subtype of this. And let's see, so the next one, slightly gross if you don't like bugs. Typhus. Typhus, that's a louse. Typhus is called also camp fever or ship fever, and the reason for it being called ship fever, camp fever, is because it flares up in times of strife. And the reason it flares up in times of strife is because you have people in very cramped quarters, such as jails, ships, camps, and so then it will spread. It emerged during the Crusades, and it first impacted Europe in about 1490 in Spain. And this is when the Christian Spaniards were fighting the Muslims in Granada. There were about 3,000 Spaniards that were lost to typhus. 3,000 were lost in the battles, and 20,000 died of typhus. And this is the case in all of these situations where there was a flare-up of typhus. During the 30-Year War, which is 1616 to 1648, there were 8 million Germans that were killed by typhus. So in these times of war, it actually has been the case that more people, either prisoners or the soldiers, died of typhus than died in battle. So same thing when Napoleon in 1813, he raised a new army of 50,000 people to replace Russian losses. 219, so almost half of them died of typhus. So it happens in cramped quarters. It's a parasitic bacteria, you can see this. So it comes to you from lice, fleas, and ticks. So it's not typhoid fever. That's a different thing. This is typhus. They are two separate things. Typhoid fever is a virus. This is a parasitic bacteria. Very, very contagious. But the good thing is that if you have a typhus vaccination, it's 100% effective. And the thing about this, what can you do, is to avoid lice. Interesting thing, though, is that the lice that we're talking about here in ticks and fleas are body lice, not head lice. And there's some evidence that if you have had head lice, your body makes some sort of antibody or protection against typhus so that later on, if you have body lice, you don't get typhus from it. So it actually gives you protection against typhus to have head lice. So interesting thing. So very, very deadly. Here's another picture that maybe you don't want to see. It played a major factor in the Irish potato famine. So we had people who were hungry. We talked about Ireland famine last time. People who are hungry, you have a compromised immune system, they're crowded together sort of searching for food, and there were a lot of people who died of a combination of starvation, famine, and typhus. And it's impossible to sort of go back and reconstruct how many people died from one versus the other. During World War I, typhus epidemics killed about 150 people in Serbia. There were about 25 million infections and 3 million deaths in Russia in 1918 to 22. This was also something that played a role in the deaths of Nazi concentration camp prisoners, and then also Soviet prisoners of war. There were 5.7 million people in Nazi custody, and 3.5 million of them died of typhus. So there's this kind of back and forth, which is a little icky, but where the Nazis are saying we didn't really kill as many people as you think because these people died of disease, but the other side of it is that, yes, but they wouldn't have gotten the disease unless you put them into these small concentration camps where the disease was able to spread in a way that it wouldn't have normally spread. So that's typhus. These are the things that happen. You have joint pains, you get delirious, very high fever, rashes all over your body, low blood pressure, photophobia, you're afraid of light. It's really, really painful, probably because you have these severe headaches, but photophobia is you just do anything you can to stay away from the light because it's very, very painful to look at light. So that's typhus. The great disease that was eradicated during my childhood, I was the last year of people who were vaccinated for smallpox. It's caused by the variola virus, which is the same disease or same virus that causes chickenpox, which you now get vaccinated against. It killed about 400,000 people per year during the closing years of the 18th century. So in the 20th century, it was responsible for between 300 and 500 million deaths. And as late as 1950s, 50 million cases of smallpox occurred in the world each year. And there are 4 different kinds of it. This is a picture of a young girl with smallpox. You see the blisters that are on her skin. I'll describe the blisters in the next page. And then this man had hemorrhagic smallpox. So again, there are 4 different types. So it's very, very highly contagious, and we developed, though, a successful vaccine. It's mandatory. It was mandatory that we, when I was a child, got the smallpox vaccine, and it was a major victory for fighting disease, for fighting pandemics, because we completely eradicated it. The only cases of it now occur, or we have in the CDC and in places where we're studying the disease. So it's the only infectious disease that is gone now. You have zero chance of getting it. Unless one of those movies, right, you have someone break into the CDC and steal the virus and spread it out among the population, right? So it's a very good story in that we've eradicated it. So another picture of a poor girl, yeah, Bangladesh. It was a bad disease. It was really bad. People lived in fear of this, obviously. She has a case of ordinary smallpox. So what happens in ordinary smallpox is that the second day, the day after you are exposed to it, which is really fast, you have a rash, and the rash then will become raised, and by the third or fourth day, you have these pustules, little bumps. They're called papules. They fill with this opalescence, like a pearly liquid. And then the pearly liquid suddenly becomes opaque. So it's, you have this transparent stuff, becomes opaque, and it is within about 2 days of that, you have them filling now with tissue. So it looks like a blister. The blister turns opaque, and then it turns into actually part of your skin. It fills with tissue. There's no pus in it anymore. By the 6th or 7th day of having this, all the lesions turn into these tissue-filled bumps. And if you touch them, they're raised, they're round, they feel like there's a pearl under your skin. So they're very firm to the touch. They're deeply embedded into your body. Fluid will slowly leak out of them, so you have this sort of oozing that comes out of your skin, and then it starts to dry up. It will form crusts, it will form scabs, and by day 20, you have scabs all over your whole body. They start to flake off, and it was about a 62% mortality rate. You could also have gotten modified smallpox. This occurs mostly in previously vaccinated people. So if you got vaccinated, you could get modified smallpox. It's less severe. There's no fever. There is the same rash situation, but the skin lesions are fewer, and they go through it more quickly, and you don't have as angry a rash as you can see here. And it's rarely fatal. So if you got the vaccine, you can still get this, and it was scary when people started to show signs of it, but then we identified it as modified smallpox. It doesn't kill you. It's easily confused with chickenpox. So that's the sister disease of shingles. The last two types, there's malignant. It doesn't mean cancer-causing in this case, but in this case, the lesions, the bumps, are pretty much almost flush with the skin. So you stay in rash phase. You don't have these huge bumps that are up. It is unknown why some people develop malignant. It's about 5 to 10% of the cases. And in this case, you have toxemia. So you essentially poison yourself. You have a rash on in your mouth, on your tongue, and on your palate. And then you have these, again, the rash stays flat. It doesn't come up to the top, but it's always fatal. So that's the reason it was called malignant. It's not as bad. You don't suffer as much from it, but then in the case of malignant, you die. The last type, hemorrhagic, is a very severe form. It's similar to Ebola almost in that you have extensive bleeding into your skin. So you have internal bleeding into your skin, into your mucous membranes. Your eyes turn bright red because you have bleeding into your eyes. It developed in about 2% of the people who had smallpox, and it was mostly adults. There's no blisters, but you just have bleeding all over your skin. It looks like charred. It looks like you're burned, charred and black. It was also referred to as black pox. They didn't know it was a smallpox variant then. So you have hemorrhaging of your skin, and also you can have kidney, muscle, liver, your reproductive organs, your bladder will all bleed, and death occurs very suddenly, about 5 days into it. Pretty much everyone who had hemorrhagic smallpox died. So that's smallpox. Measles. Measles is an endemic disease. What that means is that it's been continually present in our global community. Many people develop resistance to it. And you've heard, I'm sure, about outbreaks of measles here and there from people who have not been immunized. So in populations where people hadn't previously been exposed to measles, it can become pretty devastating. 1529, a measles outbreak in Cuba killed 2/3 of the people in Cuba. So if you have it, if it's here, all over most places in a low level, it's not as deadly as if you didn't have it. It wasn't endemic. So it was prevalent throughout the world. It's highly contagious. About 90% of people in the world were infected with measles by the age of 15. And that was before a vaccination was introduced. We had a vaccination in 1963. And so there were about 3 to 4 million cases each year in the United States. And about 20 million people worldwide died over the last 150 years. So in 2000 alone, about 750,000 people died out of the 40 million people who had it. So it's pretty low fatality rate, but it has in the past ravaged Mexico, Central America, the Inca civilization. So it is it's serious, and it is highly preventable with the vaccine. There's no treatment for it. Once you have it, you just have to let it run its course. This is a child with measles. You have a rash over your whole body, high fever. You get essentially pink eye, conjunctivitis, sores in your mouth, corneal ulceration. You can actually go blind in extreme cases of measles, and then you can get, though you don't always get, pneumonia and sores in your mouth. So it's a very, very high fever, and that's what it looks like. And again, you hear occasionally of outbreaks of measles. Last I heard there was one in California, because of this movement, again, not saying politics, not saying what I think, but of they call themselves anti-vaxxers, right? We don't want to have these vaccinations. These vaccinations are horrible and hard. Then you get an outbreak of these diseases, and they could potentially spread. So that's measles. Tuberculosis, next. Not a bad slide. About 1/3 of the world's population has been infected with tuberculosis. The infection rate globally is about 1 per second. So every second that goes by, a new person has been infected. Only about 5 to 10% of the people that are infected, though, will actually progress to an active disease. So if you get the disease, you have a 50% chance of dying from it. But if you are exposed to it, you only have about a 5 to 10% rate of this latent infection becoming actual virulent infection. So every year about 8 million people become ill with tuberculosis, and about 2 million people of them die. And this is a worldwide number. 19th century, you add these numbers up of all the different diseases, it's crazy how many people are dying of these diseases. 19th century tuberculosis killed about 1/4 of the adult population of Europe. So people just died. By 1918, 1 in 6 deaths in France were caused by tuberculosis. During the 20th century, it killed about 100 million people. It's still one of the most important health problems in the developing world. So it's still a big problem. It's characterized by a violent cough. And this cough is so bad that people sometimes will break their ribs from coughing so much. Your chest muscles and your abdominal muscles will crack your ribs. You feel like you're drowning because you can't get enough air, and you can't because your lungs are essentially filled with bloody mucus. So you just cough and cough and cough. You have terrible chest pain, and this is an old ad showing that if you have tuberculosis, the X-ray will show it before you know it. So that is tuberculosis, and it's a big one right now, but it's not considered a pandemic. It only is hitting the industrializing countries. It's hitting the industrializing countries because we don't have a vaccine that is being administered to people there. Another one that people lived in fear of, but is not as bad as you might think, is leprosy. This is caused by a bacteria, so you simply need to take an antibacterial to get rid of it. It's a chronic disease if you don't have an antibacterial, so it lasts a very, very long time, and the incubation period is up to 5 years. So there was an outbreak in Disneyland in 2015, last year. There were several people who got leprosy. People thought, oh gosh, this is so scary because you're used to these pictures, flesh-eating disease, but again, you can cure it with an antibacterial. So you get nerve damage, you get, your flesh gets eaten away. It's since 1985, about 15 million people have been cured of leprosy because we have antibiotics that we can spread around. And historically, it's affected people since about 600 BC, so another really ancient disease. they began to occur in Western Europe, outbreaks of leprosy in about 1000 AD. And this is bad when it was happening because we didn't have antibiotics. So you had these leper hospitals, numerous leper hospitals that sprang up in the Middle Ages, about 19,000. People had it in the Middle Ages across Europe. So it was a very bad thing. You had it, you always had it, you were going to die from it, and they're bacterial illness that eats away your skin, flesh-eating bacteria, essentially. These next two, yellow fever and malaria, are also things that happen in industrializing nations. Malaria is a mosquito-borne infectious disease, so you get it by getting bit by an infected mosquito. And it's caused by parasitic protozoans. So these are single-celled microorganisms. So they're not bacterial. They're plasmodiums. And you have fever, fatigue. You can see the things that happen here. Fever, fatigue, vomiting, headaches. In severe cases, it causes jaundice. So your skin turns yellow. You have a buildup of bilirubin in your skin. You can have seizures. You can go into a coma, and you can die. It's transmitted again by a biting mosquito, and the symptoms occur between 10 and 15 days after being bitten. And if you don't get treated, you can have the symptoms and they go away, and then you can have a recurrence months later. So unless you kill it, it's kind of latent in your body. Those who have survived it, the next time you get it, recurrence is typically less bad because it causes milder symptoms because you develop a partial resistance to it from having had it and your body having fought it off. So it is most commonly, though not completely, transmitted by the Anopheles mosquito, species of mosquito. And so the mosquito bites you, it introduces the parasite from the mosquito saliva into your blood. And then the parasites will travel to your liver, and that's why you get this jaundice. They travel to your liver where they mature and reproduce. So that's malaria. It's really, really bad in places where you don't have antimalarials. The interesting thing is I've been to the tropics a lot, and a lot of my students have been to the tropics, and you have these pills that are antimalarial, so they prevent you from getting it. And me and every single person, every student that I've heard from about taking these antimalarials, you get night terrors. They're beyond nightmares. You wake up and you feel like you're going to die from fright. It's a weird byproduct of taking antimalarials. So now when I go to the tropics, and I tell students to do the same thing, if you're ever going somewhere where you have to take antimalarial, it takes about 15 days to show symptoms, and you can take pills that will cure you of it pretty easily. Those side effects of curing yourself of malaria are a lot less than taking antimalarials. So yeah, I don't take those anymore. It's amazing. You have no other effects, but every single night you become petrified to go to sleep because you have these dreams that, heart-stopping dreams, like you can't imagine. Yellow fever, next to last one. This is the last one, then we'll look at a couple of future ones. Yellow fever has been a source of several devastating epidemics. Cities as far north as New York, Philadelphia, Boston were hit by epidemics in the 1700s. One of the largest yellow fever epidemics in U.S. history killed 5,000 people in Philadelphia, which is about 10% of the population at that time. So about half the residents in Philadelphia fled the city when it was going around, including George Washington. So in colonial times, West Africa was known as the white man's grave because white people preferentially died of both malaria and yellow fever. So this is what happened. It is, you have some toxic phases, but you have fever, headache, chills, back pain, fatigue, similar to malaria, loss of muscle, loss of appetite, etc. And then you get this, if it progresses to the secondary phase, you get jaundice, bleeding in your mouth, bleeding in your eyes, liver failure. And if you get the second one, so this mortality over 50% is if you get the second phase of it. It's a virus, and the yellow fever virus or vaccination is highly effective. So it's a good idea to have the yellow fever virus if you're traveling to an area where there is yellow fever. So we have about 5 minutes left, and I want to show you in a scary way, right, because we like to be scared in a class on natural disasters, future pandemics. Yeah, right, make sure you don't look at this next picture, I think, if you're squeamish, or the one after. These are the 5 things that we're worried about in terms of future pandemics going global. The first one, viral hemorrhagic fever, you may know it as dengue fever, Rift Valley fever. Ebola is part of the viral hemorrhagic fever. And these viruses spread efficiently, but the thing is they're too lethal, so they don't tend to spread. So you can get it easily, but you need to have lots of people in close quarters that are really sort of touching each other in order to get it to spread, because you die very, very quickly. So the onset of symptoms, you have medical personnel quarantining people, keeping them away from other people, and in that way we were able to, in the last couple of outbreaks in Liberia and Democratic Republic of Congo, etc., we kept them from causing widespread harm. So this is a situation where you have bleeding. You get these blisters that are pustules, and they fill with blood, and you essentially bleed to death internally, and you can bleed out of your eyes, nose, your mouth. So you have a lot of bleeding going on. Virtually everyone who gets it dies, and dies very quickly unless you have treatment. So that's the one that we are kind of worried about because of genetic mutations. Any of the viruses, you have billions of viruses, individual viruses in your body if you have this disease, and all it takes is for one of them to slightly mutate so that you can get it by coughing, or you can get a less virulent strain, or it will become a lentivirus, so it takes a long time to show symptoms, and that would be very, very bad. So we're kind of living in fear of any sort of viral hemorrhagic fever viruses going around in the future. You know SARS. SARS was pretty recent. It's called severe acute respiratory syndrome. It's dangerous. It is highly contagious. The discoverer of it became infected with it and died. It's caused by a virus, the coronavirus, and it was a good news story in that global health authorities, international health authorities, the World Health Organization, they helped to slow the transmission, eventually broke the chain of transmission, which ended in localized epidemics and then sort of petered out, and it didn't reemerge. But people are always, who study this, are always watching for a suspicious case of what it's called atypical pneumonia. I remember the outbreak of this. So there were a couple of people at Northeastern that got it, students at Northeastern that got it, and Northeastern was so concerned from a sort of public health and also concerned for the students' image that they put all of the students who got it into hotels and just paid for the hotel room and said, stay off of campus. So they just said, get out of here. So that's isolating, letting them run through it, getting obviously proper medical attention will cause it to kind of go away. We talked about influenza, so you already know about influenza, but the possibility of future outbreak, we have all sorts of different variants of influenza. Some are light. You may have had a virus, an influenza virus that was sort of a cold, you coughed for a few days, had body aches, and we're done. Some get really, really bad, and you can be out for 2 weeks, incapacitated for 2 weeks, and have complications that lead to death. These are zoonoses originally, which means that they came from organisms, from animals. The Sars Avian Flu, which is this next one, came from domestic poultry. So a subset of influenza, which you can get by sneezing, is avian flu. So this was detected in 2004 in Vietnam, and it spread pretty rapidly. But again, we had this fear that a subtype of it could cause a global pandemic, but we were able to catch it. We were able to isolate people who were infected with it, and we were able to change the way that we're handling these birds. So it was never classified as a pandemic, but we know that it's out there, and we know that it attaches very, very deep in people's lungs. So it requires close, prolonged contact with people, not just being sneezed on. So that luckily limits person-to-person transmission. But it's the same sort of symptoms that we have in the influenza virus. Next one is a bad picture. My daughter says, don't look at this picture. So the most widespread epidemic of Ebola, of the viral hemorrhagic fever, is Ebola, and it's currently ongoing in several West African countries. Up to 70% of the people who have it will die. So pretty much everyone who has it will die. It was in Liberia, it was in Sierra Leone, there was an outbreak in Senegal and Mali, so it goes on in these countries. In Africa, there have been a total of about 25,000 cases, and of that, about 15,000 deaths. So the World Health Organization, thinks those numbers are kind of okay, but the first outbreak reached epidemic proportions. So there were a lot of people that had it, even though future ones have been brought under control in a few weeks. Extreme poverty, dysfunctional healthcare system have caused it to spread a little more because people didn't get their act together. Also, failure to control burial customs. So we needed to wash so local customs were washing the body and sort of massaging the body after death, and so people had to not do that because that's a great way to get it. So they had to sort of make sure that people don't touch dead bodies. And this is a picture of someone who had viral hemorrhagic fever, just bleeding out from everywhere, all over. And it's very painful to lay down. This person on the top has perished, but very painful. That's why the arms and legs are up, because touching anything is intensely painful when you have it. And this young child has Ebola. He's bleeding out of his nose. So why the fear? In all these disasters that we've talked about, it seems, I've done in the past, ask the class, what are you most afraid of? Seems like this is the type of disaster that people are the most afraid of. We have all these movies that are out there. Maybe a good thing to watch if you wanted to look at how things spread through, because the science behind these is actually quite good. But this is, the thing that people fear the most, some contagion that becomes a pandemic. The next slide, which you see if you're looking on Canvas, but I took out of here, if you want to investigate this in more details, nothing that will be on the quiz, but there's a link to Ebola virus, how it's spreading, and what people are doing about it. But for now, that's it, and we're out of time, so see you Friday for the third quiz.